Good afternoon. My name is Aaliyah Quintanilla, and I am presenting our scholarly work project with Reagan Robertson, Carly Lindsley, and Priscilla Rodriguez. So our research question for our scholarly work is want to investigate the long-term effects of ABA on emotional well-being of adults with autism spectrum disorder.
The specific aims of our study are seeking to assess opinions and lasting psychological effects of ABA among adults with autism spectrum disorder in regards to mental health in order to better treat this population. Our other specific aim is to compare the opinions of the psychological effects of ABA with the same population in order to promote advocacy for an at-risk population. So why ABA therapy and what is the significance behind this? So ABA is one of the most empirically studied and validated approaches to treating children with ASD. Studies have shown great success implementing ABA within populations of children who fall under specific categories such as higher functioning and English speaking. But do the benefits outweigh the risks? So there is little evidence on the long-term psychological impacts of ABA therapy amongst all individuals with ASD, especially those that are considered lower functioning, non-English speaking, and nonverbal. There also is a few studies out there that do look into post-traumatic stress symptoms in this population. So what does this mean for future research? Comparing outcomes of ABA therapy versus traditional OT interventions for children with ASD, and also just looking at the child or the adult as a whole, looking at their social well-being, their occupational functioning, and social participation.
To further investigate the long-term effects of applied behavior analysis intervention on individuals with autism spectrum disorder, we used a qualitative research design by using a semi-structured interview over Zoom with adults diagnosed with ASD that underwent ABA therapy during their childhood. The interview went over their experience with ABA and the lasting effects the intervention has had on their emotional well-being now that they're adults. The participants were recruited by a convenient sampling of 10 clients, which was conducted via online social media platforms such as Facebook and Instagram, as well as through professional relationships. Inclusion criteria included 18 years of age or older with an autism spectrum disorder diagnosis, having undergone at least one session of ABA therapy, and being able to communicate and follow one-step directions in English or in Spanish. Here on this slide, we have some of the questions that we included in the interview, such as what is the definition of ABA? What is your knowledge of the evidence behind ABA? What is your knowledge of the evidence supporting the occurrence of PTSD in children that have undergone ABA? What is your experience with the clinical application of the evidence? Some benefits, pros and cons of ABA, and really looking into the effects of ADLs, IDLs, social communication, volitional play, and the emotional well-being following the ABA sessions.
For our data analysis, we had 4 researchers separately code the interviews to find common themes using descriptive coding, so keywords or phrases. And then the researchers came together and collaborated on common themes and then used these themes to determine the frequency of these themes or keywords in the interviews. And so these common themes were trauma, behavioral approach, and anxiety. And this was determined using the frequency of the descriptive coding that was agreed on in the second round, with positive reinforcement and punishment and stimming being the most common codings.
There's limited research on ABA therapy from a qualitative perspective. A majority of the research done is quantifiable. However, new research is beginning to surface that shows a link between ABA therapy and negative emotional well-being. Some common findings are PTSD and psychological dependence. Our study will provide an in-depth perspective of the general knowledge and perception that occupational therapists currently have regarding the use of ABA on children who have autism. We hope that by completing this study, we will have a better understanding if there are lasting negative effects linked to ABA therapy. If we find there is a connection, then we can support advocacy of non-harmful interventions performed by an occupational therapist, including trauma-informed care. In our current study, we hope to determine common themes of lasting effects, if any, that resulted from ABA therapy on individuals with ASD in their childhood. In the future, we hope to generate a survey of knowledge regarding ABA and ABA outcomes among several OT practitioners. In the future, our research team or other individuals can generate studies to look at both of this research and compare the outcomes of ABA therapy on children with ASD to outcomes of traditional OT interventions using both the qualitative study and the survey that we conducted. We specifically want or hope to find more information on emotional well-being and social participation for individuals both in childhood and throughout the lifespan with ASD who have completed ABA therapy as a form of treatment. And here are references.